Welcome everybody. I'm very excited to welcome you here today, both attendees from Ireland and internationally, to the first of the masterclass series of the working group within the International Neurodiversity Society. This has just recently been established, and the aim is to facilitate international collaboration and sharing of knowledge and expertise in this area. And it builds very much from a conference that we ran in December with over 1,000 people registered, again, from an international basis on this topic over a 2-day period. The hope is that through the masterclass series and indeed through the International Society, that it will lead to the development of knowledge, information, understanding, promote research, and when appropriate, promote and lead to development of clinical services. We are delighted at UCD in that we have set up a UCD CHAS Neurodiversity project led by Dr. Blona Gavin, child and adolescent psychiatrist. And we're joined by a number of people from UCD School of Medicine, psychology, law, and health and agriculture. And I think some of the names are on some of those slides. I'm particularly grateful, Beth Kilkenny, today for organising the conference. And we look forward to letting you all know that it's recorded, and so it'll be available to you online afterwards. So without further ado, I'm going to, as our inaugural speaker, we are indeed most honoured, Simon, to have you present to us here today. I know you don't need any introduction, but just by way of kind of reminding people, you bring with you really a wealth of clinical research, academic expertise in this area. You've been in the field, you look very, very young, but I know that you've been in the field for many times. I was a consultant in Guy's Hospital. My first job was in the Newcomen Centre, where it was assessment for children with autistic spectrum disorders. And already well into my training, I was familiar with your work. You're a professor of psychology and psychiatry in the University of Cambridge. You're a fellow at Trinity College there. And you're also director of the Autism Research Centre, and indeed have been director and president of the International Research Centre for Autism. Your publications, your writing material, your presentations, many of them are available on YouTube for anybody who's interested, are just amazing, unbelievable, and really delivered with a very easy tone. So I'm looking forward to our conversation today. You set up the first clinic, I guess, for individuals with autism in the UK in 1999. And we might come back to that later in terms of how that might have influenced your thinking, your theories. But I guess the purpose of today is to talk a little bit about your new theory, which has been, I haven't finished the book yet, Simon, but I intend to because it really is nice. It's nicely broken down into chapters, which somebody like me, I like that because I can do one and tick it and move on to the next one. But the title is The Pattern Seekers, a New Theory of Human Invention. And maybe if you'd just like to kick off the session this evening with talking us through a little bit about this theory.
Sure. So thank you very much for inviting me to give this, to participate in this inaugural session. And I'm first of all, before we talk about my book, The Pattern Seekers, and and its link to people who are neurodiverse, I just want to say how delighted I am to hear about the International Neurodiversity Society. You know, this is a terrific initiative, and I wish it success.
Thank you.
So,
Thank you.
So in my book, The Pattern Seekers, I'm kind of exploring a question, which is whether there's a link between autism and human invention. And I kind of lay out a lot of evidence in the book that there is a link, even though the reader might be a bit surprised by that. because autism is a disability, and traditionally, you know this as a clinician, that we've focused on the deficits, the difficulties, the challenges. We haven't particularly linked autism to what some people would say is, a crowning characteristic of human species, which is the capacity to invent. And yet that's what I kind of do in the book. I sort of look for these connections, and there are lots of them. And the reason for doing it really is because I'm advancing a theory in the book that, one of the core features of autism that's been neglected is that they have a strong interest in patterns, and that this kind of pattern seeking is what makes human beings different from all other animals, in terms of being able to understand systems in the world. That there's very little evidence that other species living today, or our ancestors before Homo sapiens, could really understand how systems work. And yet when we look at autistic people, they seem to be very drawn to understanding how systems work, whether we're talking about a mechanical system or a mathematical system or a musical system, or a natural system. There are lots of kinds of systems in the world. And the way that uniquely humans, understand systems is we tend to take them apart, figure out what is causing what, and then maybe put them back together again. And in doing so, we often come up with new systems, and that is the capacity for invention. So that just gives you a little taster of the theory in the book.
Do you think this pattern is innate? Is the young person born with it? Is there a sense that it is molded? And I know we might come back to kind of the genetics, but is it molded by environment? Is it that, the young person either personally is reinforced by something working, as, perhaps our ancestors were, or reinforced by other people in terms of encouraging that style of thing?
No, I think that's a great question. Obviously in human behavior, nothing is 100% genetic. There's always kind of a role for environmental experience, social experience. But we did have the opportunity to work with a company called 23andMe, which you've probably heard of. It's a kind of personal genomics company, where people pay $100 to know what's in their genetic sequence. And we were able to ask the customers of this company to take one of our questionnaires. And it's a questionnaire about how interested are you in systems and in patterns. What we found was that there are indeed some common genetic variants, so genes that we all carry, but they come in different versions, that are associated with how high you score on this questionnaire. So it's called the systemizing quotient, and there is a genetic element in there. So that just suggests that, we all find systems relevant to our lives, but some people really delve into systems much more than others. I call them hypersystemizers. And autistic people tend to be in that group, that they are attracted by systems in the world. If you think about, autistic kids that you've met, and they might be assembling, their toys in a very systematic way. They might be building Lego constructions in a very systematic way. They might be collecting things in a very systematic way. So autistic people seem to be kind of drawn to systems in different ways. And that there does seem to be a kind of a genetic element to it.
So in terms of some of the people who, were higher scoring on this, and the genetic codes they had, how do they link with what is known from clinical research in autistic populations and the genetic risks? Are they aligning very closely with them? I know, as you say, it's multifactorial. There's no one gene.
Interestingly, we did do an analysis where we looked to see if there was an overlap between the genes that are associated with systemizing in the general population and the genes that are associated with autism, just common genetic variants that are associated with autism. And there was indeed an overlap. So again, one of the sort of ideas in the book is that when we think about autism as a disability, and which we know is strongly genetic, we should think about those genes, not just in terms of being linked to disability, but also being linked to talent in pattern recognition and in understanding systems. It's the very same genes that are at play in people who love systems, whether they might be working in IT, in computer science, or in engineering, wherever there are systems that need to be understood. Those individuals who are kind of gifted at understanding systems are carrying the same genes as, well, there's an overlap as the genes that we see in autism.
I might come back, Simon, to that whole concept of, which I've heard you speak about so eloquently, about disease, disorder, and just emphasizing the importance that neurodiversity is different. It's not a impairment necessarily, but I might revisit that. But just in terms of in your book and with the theory, in addition to the systemizing quotient, you've also looked at the empathy quotient. Yeah. And I guess if you can speak a little bit to that, and particularly maybe tease out the two different empathy skills, the cognitive and the affective skills a little bit.
Sure. So that's the other psychological process that I look at in my work, which is empathy. And just like systemizing, we find individual differences. Some people are average, some people are above average or below average in how interested they are in systems. So with empathy, we find people show individual differences. You mentioned that, there are different types of empathy, and that's absolutely right. It's a very important point. So scientists tend to distinguish cognitive empathy, which is sometimes known as theory of mind, which is the ability to imagine what someone is thinking or feeling, to put yourself into their shoes, if you like, from affective empathy, which is having an appropriate emotional response to what someone is thinking or feeling. And autistic people seem to struggle with the first type of empathy, sort of imagining what's going on in someone else's mind. But they don't seem to be, to have any difficulties or difference in their affective or emotional empathy. So once you tell them that somebody is suffering, for example, it upsets them just like it would upset any of us, and they want to reach out and help. So, I've kind of discussed sometimes that autism is almost the mirror image of psychopaths. Because when we think about psychopaths or people with antisocial personality disorder, they might have excellent cognitive empathy. They can imagine what someone might be thinking or feeling, but they don't have the appropriate emotional response, which is why they can manipulate another person and why they can hurt another person. And that isn't the kind of typical profile of autistic people.
So in your book and in talks, and indeed we were lucky that you gave a presentation for us at the Neurodiversity Conference that we ran in December. You had a slide up about the 5 different brain types, and somebody at this end having very high empathy, systemizing to the other. Where do you think, and I know today is about diversity, and I should also say that today is about exploring the language, the debate, the discussion, the concept. So do forgive me, Simon, if I ask you silly questions or insulting questions or whatever. But where do you think, the majority of people are on that, the 5 different brain types? And is there possibility to move between, either based on your own internal states at the time, or based on if you have difficulties in an area where you yourself are seeking to ameliorate it?
Yeah. So let's deal with the first part of this, which is the idea that you can divide the population into different brain types, different cognitive profiles. So we were talking about empathy and systemizing, 2 different psychological processes. And what we do in our research is we look at the difference between these 2 dimensions, because some people are very strong in systemizing, but they may be only average or even below average in empathy. And we call that type S. And other people have the reverse profile, so very strong in empathy, but only average or below average in systemizing. So these are kind of just, one is not better or worse than the other. They're just different ways of looking at the world. Your attention is either drawn towards systems or towards people, to varying degrees. Some people seem to be equally good at both. So that creates a 3rd group, if you like, in the population. We call them type B for balanced. And then there are extremes. So people who kind of systemize almost non-stop. They see patterns everywhere and they're fascinated by patterns, but they really struggle to understand people. And then the reverse, people who are kind of preoccupied by other people's thoughts and feelings. They empathize non-stop. They're always thinking about their friends or who they need to be worrying about and so forth. But, patterns and systems, they might be either disinterested in or even struggle with. So this gives us like 5 groups in the population. And I think that is a form of neurodiversity. So when we think about neurodiversity, often people, they use the term to refer to people who have a diagnosis of one kind or another: autism, ADHD, dyspraxia, dyslexia. Those are the kind of common ones. But actually, I think we can see neurodiversity in everybody. We're all different. And I've just laid out, 5 different, if you like, groups that you see in any population, because we all lie in one of those groups in terms of our interest or our aptitude in empathy and systemizing. And then the second part of your question was, can people move between groups? Is that right?
Yes.
And I don't know that we've got the data yet to know about that. I think what we do know is that you can find these 5 brain types in children, in teenagers, in adults, and there are different measures available to sort of identify what kind of brain does a person have. But whether people kind of change very much across their lifetime would require, so-called longitudinal research or developmental research. And I just don't think those studies have been done yet.
If you think from a research perspective with numbers and the concept of regression to the mean, there is that sense that people or researchers, statisticians worry about the outliers more. Do you think that there are the same? Because obviously one of the issues is whether there's some impairment, be it personal or based on a misfit with either your job or society or whoever you're dealing with. That if you are very much systemizing and in a society which is very socially driven and reinforcing, are there the same difficulties or the same sense of diversity or being different in the people to the left of that, the high empathizers?
Yeah.
Do you think there are?
Well, I think, I think what you're picking up on is that it's not just about what kind of mind do you have, but what kind of environment are you working in or living in? Because that may or may not make you feel comfortable. So if you're a strong systemizer, for example, and you're working in an environment with lots of other people just like you might feel you fit in perfectly well and you don't experience any sort of struggle. If you if you're a strong systemizer, and you're surrounded by people who are very different to you, then of course you might start experiencing that sense of difference. If your job or your work, or even your kind of educational setting or your family puts a lot of pressure on you to be sociable, for example, when that's not your natural kind of comfort zone, that could give rise to disability. You could start feeling stressed. You could start feeling bad about yourself because you're not sort of in an environment that lets you kind of flourish. So I think, a lot of what we need to think about as we design school settings, as we design work settings, is to what extent are we being inclusive so that people with these different brain types can feel that they fit in, and what adjustments do we need to make for people with different brain types?
One of the objectives of the Neurodiversity Program in society, and Simon, you've been involved in this area yourself because you're advisor to many companies, or so one of the objectives is to support neurodiverse individuals in the workplace and indeed in university, and to work with the lecturers and educators to make sure that there is that right fit. Do you think that, at a certain level, that individuals are either high systemizers, but also individuals who might be high at the other end, that there are naturally different jobs, professions that might lend themselves more to those skill sets? And indeed, perhaps with the skill set comes maybe the deficit of not having the other, if you're just talking about balance,
Sure.
One is high, the other side is low.
Yeah.
Are there certain jobs and professions that kind of fit that theory?
Yeah, I'm sure that's true. I mean, if we take people who are strong at systemizing, you can apply your systemizing skills in many different areas. So some people might be attracted to be a computer programmer because you have to be highly systematic. Others might be, systemizing in a very kind of much more hands-on way, like fixing bicycles, or being a chef, because when you cook, you have to be highly systematic in terms of understanding what's going to lead to the best result. It's not just optimizing your bicycle, but it's optimizing your, the meal that you're making by just tweaking the different variables, the different components in the system. A little sprinkle of this and a little less of that can really change the outcome. But in terms of jobs for empathizers, you could imagine that people who are very strong at empathy might be more attracted to work with people-centered work, like social work or psychological counseling, maybe teaching, because you need to have good communication skills and understand what the other person needs to know. This is all kind of aspects of empathy. But I think perhaps what we're also wanting to aim to move towards is where you can see that in any setting, educational or work, that each person brings something different to the whole. So if you're trying to create a team, or if you're trying to set up a classroom, it's fine to have that kind of diversity. It even sort of enriches what you're trying to create. But you have to also kind of acknowledge and make space for that diversity, that people bring different strengths, that we're not all the same.
Well, with your cooking analogy, I mean, diversity is the spice of life. And certainly love some of the chefs, and they're very, very emotional, and you imagine that they're really empathic to the person. So, there is that balance. But with that, and I fully welcome that idea that in fact, it would be very wrong to kind of, have stereotypical jobs that fit one or other group based on your theory or indeed personality attributes that people have. But part of the issue then, I imagine, becomes, and it's the same concept when you're stressed at your job. It's not necessarily your problem, but it's that mismatch between you and what you have to do. And thinking through, in some ways, even with my own kids, the idea was, well, once you get to university or to the opportunity to work, you're able to choose where your natural fit is, where you do best, and where you enjoy it the most. It can be very difficult along the way, but even as an adult, where the job or the school experience, whether it's educational or social or behavioral, makes you, because that's just the way things are at the moment, they're slightly intolerant of difference from just getting through the class or just getting this job because this is the way we do it. Education is going to be key, but do you think it is possible that, people that, I suppose knowledge, the neurodiversity awareness, that it can bring that shift in the ability that somebody with their skill set can be facilitated in what might otherwise have been a rather structured, organized, conveyor belt sort of system, whether it's in learning or in production or whatever?
I think you might need to sort of help me a little bit with this question, just to elaborate exactly what you're getting at.
Okay, so if you are a systemizer, and I know your research would show that, for example, in Silicon Valley or in Eindhoven, that there are individuals who migrate to certain jobs because they fit with their skill set. The difficulty then would be that you would have less diversity in other jobs because it's kind of reinforcing itself. But actually, those same skill sets would apply so very well in many, many occupations if the system, the organization, was able to kind of mold itself a little bit better, be a little bit more tolerant, allow a little bit more individuality, for example. And I suppose that is my question. Do you think, there is a way that we can get there? In the same way with school, Simon, if you think of a young person at school who learns in a slightly different way, but the teacher isn't going to do it. She's 30 kids, she's got, 45 minutes to get her information across, and she's doing it because this is the way she does it.
Right.
So either the child has to struggle a lot.
Yeah. So I think you're asking about sort of whether the school systems or the workplace needs to be more flexible. Is that right? To the sort of to the way that the individual thinks. And my answer is absolutely we need to be flexible. So we've got this notion at the moment that kids start school, let's say at the age of 4, and that kids are treated as if they're all the same. So there's one kind of method of teaching that's given to 25 kids in the class, as if they're all kind of learning in the same way. And yet, even from my kind of outline of the 5 different brain types, it means that amongst those 25 kids in the class, there are going to be some kids who are very comfortable learning from a teacher, looking at his or her face, listening to their voice, reading between the lines, picking up humor. That's, the kind of more empathic kids, if you like. There'll be other kids who would really prefer not to learn in that way. They might prefer to learn in a more solitary way, learning by doing, learning by through activities, maybe in a solitary way. And the social side of it actually gets in the way of their learning, And so, just taking that one example of kids in primary school, we've got to sort of address the question, how do we sort of make sure that kids can learn to their best, in the best way for each of them, and yet we've only got one teacher, and that may mean that we have to be quite sort of creative in how we sort of offer our teaching. It may have to be that we look for the kids who prefer to learn in a more social way. We look for the kids who prefer to learn in a more individual way. And we just give them a little bit of space, even within the classroom, to be doing different types of activities. Or maybe we have to break things down into smaller groups. Because otherwise, what we know is that if we take autistic kids, they love to do their own thing in a solitary way. And they sometimes feel overwhelmed with anxiety and stress if they're in a very sociable environment. The danger is that child can feel school is the worst experience, that they become school refusal kids, that they don't want to go to school, they hate school, they get turned off from learning. So somehow we need to start thinking about how do we make space, whether it's in the classroom or in the adult world of work. How do we make space for people who think differently and who learn differently?
And Simon, along those lines, as a clinician, and parents will often come to us and their child is struggling significantly at school because of the inability to mold the system or be flexible. And in other settings, they would learn and develop so much more easily because it's in a way that they can learn. At times, we're asked the question of should we consider different schools? Now, you're all familiar that there's different schools where they have a different way of teaching. They're mainstream schools, but just the school is smaller, they're more diverse, they're international, they maybe have a lot more subject types. So sometimes, one makes a recommendation that maybe changing the school might be beneficial.
Yeah.
And sometimes it's for a short time and the child then rejoins, if they end up in a non-mainstream, that the encouragement is often when they can rejoin. Is that something that you feel, should be an acceptable solution to this difficulty, which might be transient just for the period that they have to go through it? Or,
I think, again, you're a clinician, so the importance that ultimately we've got to find an approach that leads to the child's well-being, that leads to the person feeling happier. And if they're really distressed in a mainstream setting, and the mainstream setting can't meet that child's needs, then there may be a very strong case for saying, let the child learn in a different part of the school. It may not have to be a different school, but it may be a different part of the school that's quieter. Bringing this back to autism, although obviously neurodiversity applies to many different types of people. But if we just focus on autism for a second, we know that many autistic people have sensory hypersensitivity. So as well as them maybe struggling because there's too much social pressure, there may also be the environment may just be too loud or too bright, almost aversive, and that they just need a quieter, calmer environment in which to learn, because none of us can learn if we're stressed, and that may mean a different space and a different teaching style. But I think before we kind of move to the decision to move a child into, let's say, a special school, we need to also think, what is that saying about the mainstream, that we can't accommodate the person in the mainstream?
Do you think that, with time, society will get there where there is that recognition of a need to really, change things to suit the learning style of individuals. And then you have to be mindful of, we go back to this horrible concept of the majority, where the outliers, may be at risk of being less facilitated.
Yeah. I mean, at the moment, we all recognize that education is really important. You only get one chance, at going to school as a kid, and if you get it wrong, that can have long-term consequences for that person, and yet we also know that the education sector is very poorly funded. The reason that we don't have the opportunity to maybe divide a class of 25 kids into small groups with, a second or a third adult to sort of get involved in the teaching, like teaching assistants or whatever, is just resource, but, these become sort of policy decisions really for governments. Do we want to spend a bit more money in our educational settings to make sure that children are happy? And it's not a one size fits all. So we might need to provide a variety of sizes so that kids don't feel that they are, the square peg being pushed into the round hole. At the moment, the whole sort of framework for education, the national curriculum, is that we kind of push all kids through the same pipeline. And it's doing children a disservice, because children have different interests as well as different learning styles.
With the Neurodiversity project, I guess at least, in UCD, Stanford, and in Australia, it is very much that. It's about trying to see, can the educational environment be changed to maximize mutual benefit for teacher and for student. And just
maybe I can, if I could just pick up on one more of those points on the national curriculum, because by the time kids get into secondary school, they're being expected to study maybe up to 8 or 9 different subjects, or even more, and they're being asked to switch subjects every lesson. And again, bringing this back to autism, we know that autistic kids and teenagers, they love to go into things more deeply. They love to go into things in more detail than the average person. And the details matter to them. This may be one of the features of being a strong systemizer, is that the details matter. So if you've got a kid who becomes fascinated by history, let's say, and they're learning one little piece of history, a particular battle, the autistic kid might want to know, well, who were the individuals in that regiment, and what were they wearing, and what were their names, and how did they die in the battle? They're focusing in on the sort of the small details, whereas the history teacher they don't want to just focus on that one battle in huge detail. They want to get the sort of big picture across, and then suddenly the bell rings and you're expected to switch to geography or switch to biology. And the autistic kid is still focused on those small details that are not yet, we haven't finished that topic. And you can imagine how frustrating that is for a child. And so it's not that one learning style is better or worse, but we're expecting the kids who have that detailed, approach where they favor depth over breadth, we're expecting them to be able to pick up the same information and do as well as the kids who have that more kind of superficial approach where they favor breadth over depth, and somehow we just need to kind of acknowledge that that's, not everyone falls into one. I know that I've made this point before, but not everyone falls into kind of one way of learning. And we've got to build into how we offer education, this flexibility, and the national curriculum may be actually, getting in the way of providing good education.
Well, I empathize completely with that, Simon, as a terrible multitasker myself, who is that superficial person. And it brings with it a lot of problems, where I wished I was able to focus and and narrow down on the detail. But I guess fortunately I've finished with the national curriculum for now. So can I come back to the concept of disease, disorder and difference? And I think there's really the whole concept of neurodiversity being just different for many is so crucial. And ask you a little bit about, there was huge concern with DSM-5 when it was coming out that it was going to change diagnostic criteria, and people were very worried about it. So it's thinking a little bit of accepting that there will be a small minority, or I'm not sure what percentage, of individuals with any different style neurodiversity who will experience impairment and distress linked with their neurodiversity. And having a diagnosis becomes the gateway, one hopes, to service and to effective treatment. So can you say a little bit about where you think that is, and whether there is any risk at all in emphasizing that neurodiversity is just different? It's not necessarily the words are diseased or disordered or inferior or less good. Whether there's any risk that those that do need additional supports will be adversely affected by that movement?
Yeah, I mean, it's a very important topic about the language we use, and also, you know, as you call neurodiversity a movement, you know, there is a kind of risk that it becomes so campaigning that we're not actually sort of really thinking through the complexity of it. You know, so let's take these terms, you know, disorder, disease, disability, and difference. I call them the 4 Ds. And actually, if you think about autism again, you know, I think all 4 of them can apply depending on which aspect of the person or their lives you're looking at. So difference certainly applies. You know, we've already talked about how autistic kids may have a stronger preference for detail, may have sometimes an excellent memory for detail, and may want to focus for much longer periods, going into depth. So that's a difference. You know, disability probably also applies. You know, they wouldn't need a diagnosis if they weren't struggling in some way. So it's not just difference. You know, there's obviously some evidence that they are suffering, is the language that DSM or the, you know, Psychiatric Association uses before you would give a diagnosis. You know, and then there's the word disorder and disease. Well, some aspects of autism may involve disease. So disorder and disease are medical terms, but disease, the term disease is used when you know the cause. And we could think of something like epilepsy as a disease, and which is more common in autistic people than in the general population. You know, and disorder is where, again, there's evidence of you know, a medical condition, but where we don't know the cause. We don't yet know the cause. So if we took something like gastrointestinal pain that many autistic people report, you know, that you could easily call that a disorder, but we're not yet at the point where we can pinpoint what's causing it. So it's not that autism, you know, is just one of these 4 Ds. Different aspects of autism and of the person might reflect all of the 4 Ds.
And I guess one of the ways as a clinician, because typically when you make a diagnosis of autism as a clinician, it's because either the parent or the young person themselves has sought help for a difficulty that they have, and it falls into that category, either in repetitive behaviors or socializing and communication difficulties. But many times what you find within child psychiatry is you're assessing a child who's come with a different problem, low mood or anxiety, or indeed hyperactivity. And part of that assessment uncovers some of these areas that they have. And I
Yeah,
guess they wouldn't have been impairing to them at all, except that the secondary consequences, which goes back to that misfit idea, I guess, that, you know, in an ideal world, the differences would be celebrated for what they are.
absolutely.
But in a less than ideal world, they're contributing to impairment, at times, some of that leading to disability that needs additional support.
Yeah,
And the issue then is it's so important for a clinician to be mindful of that much broader concept of neurodiversity than the, you know, kind of distressed group, and that's another D for you, that are coming to the clinic. Yeah.
yeah, yeah, absolutely. So I'm glad you've mentioned mental health as well, because just keeping the conversation on autism, you know, we know that sadly, a lot of autistic people have poor mental health, that they struggle with high levels of anxiety and depression. And these may be secondary to not getting the right support, not being in the right environment. So, you know, there's the neurodiversity part of this, which is kind of recognizing that people are just different and that some of those differences should certainly be celebrated. But then there's the kind of mental health part, where if the person isn't getting the right support, it can lead to a whole suite of consequences. You know, I was very struck that in our clinic, you mentioned earlier that we established a clinic for adults who wondered if they were autistic. But what we found was that we asked them about suicidality. We found that 2/3 of them had felt suicidal, and 1/3 of them had actually attempted suicide. These were, you know, shockingly high rates. And I think and suicidality, as you know, reflects that the person is feeling really bad about themselves, have levels of depression. And, you know, I think it probably reflects lack of support. So when we're looking at the whole person, we have to also look at all of these different aspects.
Simon, can you, moving a little bit to talk about the gender difference in neurodiversity, be it autism, ADHD, dyspraxia, and reading the bits of the book that I did get to read and listening to you speak, I was very much minded of the concept of the man as the hunter-gatherer, going out, you know, getting food, and the female being more nurturing, empathic, at home, watching the offspring and getting the community together and sorting out things. And it was kind of aligning with both stereotypical views of male, female, but also I was thinking about the male brain, you know, tending more towards more systemizing, and the female brain, or the female individual, should I say, maybe having higher scores on the empathy quotient.
Yeah.
So I wonder if you could say a little bit about, because one of your ideas was that autism may reflect an extreme form of a masculinized brain, if that's the correct wording to put on it.
I mean, you know, it's very difficult to, you know, to know what is the correct language here. But if we just stick to what the data tells us, what the science shows, is that there are sex differences on average in empathy and in systemizing. So we conducted a big study of 600,000 people. It was an online study. And what we found was that on average, females do score higher on the empathy quotient. And again, on average, males do score higher on the systemizing quotient. But, you know, the dangers when you're looking at sex differences or gender is that people, you know, people might misinterpret this kind of research as if it's saying that the differences apply to all males or all females, when all it is a kind of difference on average. So that means that you can, you know, any given individual may be typical or atypical for their sex. So you shouldn't use the research in any, I mean, the research can't be used to say anything about an individual. And, you know, equally, knowing what someone's gender is doesn't tell you anything about what kind of brain type or cognitive style that they have. You know, and if you presumed anything on the basis of knowing their gender, that would be a form of discrimination. But, you know, back to this question about how autism might relate to typical sex differences. Certainly in my work, I've suggested that because autistic people are more drawn to systems, and that's more common in males, and struggle with empathy, and empathy is kind of, on average, stronger in females, that you could see autism as an extreme of the typical male brain. And again, the language is difficult to get right, but actually that research led us to look at the role of prenatal sex steroid hormones like testosterone and estrogen, because it's been known for a long time that these hormones change brain development in the womb, change the fetus's brain development. And so we've conducted research looking at the levels of these hormones during pregnancy in pregnancies that result in a child with autism, and finding evidence of both elevated testosterone and elevated estrogens in the pregnancies that later result in autism. So some of this psychological research is opening up kind of new avenues for understanding what gives rise to diversity. We talked about genetics earlier, but genetics, it may only be one factor. Prenatal hormones may be another.
In terms of linking both with inter-utero experiences, testosterone obviously being one of them, but environmental stress on a mother who's pregnant. And I'm thinking also of, first of all, males, the incidence of autism has been reported. And again, I'm mindful that this assumes a diagnostic category, has been reported to be higher in males than in females. But also there has been a sense of an increased prevalence. Now, whether that is a biological issue or whether it's, you know, an administers, whether it's changing classifications. What is your take on that? I mean, and I appreciate that pregnancies of today are very different than they were before by way of all the stressors perhaps on the mother and father and family unit.
Yeah, I mean, on this question about whether stress, maternal stress plays a part in the development of autism, I just don't think we've got good enough evidence to evaluate that either way. You know, maternal stress is probably a very difficult thing to study. But on the question of, you know, is autism diagnosed more often in males than in females? We do know a lot about that because, you know, autism has been known about since the 1940s. And all the way through since then to today, we see that the prevalence of autism reflects, you know, it's more commonly diagnosed in boys than in girls, or in men than in women. But that sex ratio seems to be changing with time. You know, many clinicians who might be listening today will know that more girls and more women are coming forward for a diagnosis because they suspect they have autism. And that whereas in the old days, the sex ratio was about 4 males to every 1 female, today it's more like 3 males to every 1 female, or perhaps even a bit lower, you know, 2 males to every 1 female. So the clinics are still sort of seeing, if you like, you know, a bias that more males get diagnosed. And the change historically may just be because clinicians were less skilled at recognizing autism in females, or, you know, maybe there was more stigma on females, that they should be more sociable, or they should be able to communicate well, and that they were hiding their autism, perhaps at some personal cost. These are kind of topics that are now being discussed, and it's really good, because, you know, if stigma has been part of the barrier for why girls and women have not received a diagnosis, we need to remove that stigma, because, as you mentioned earlier, a diagnosis could be your gateway, your passport to getting support.
I think the other thing, Simon, is preconceptions of the clinician. The same is happening in ADHD, where it had been thought that there was a huge preponderance of male ADHD. But actually, when they look at the research, it's more that males are more likely to be given a diagnosis at a clinic. And when you do community population samples, you find, as in autism, that the ratio of male to female is much less than thought. And even with eating disorders, it's similar. So it's the whole importance of individuals, clinicians, you know, service providers, education, employment, being aware of the limitations of certain, you know, systems, DSM system or access to care system, and thinking outside that. Simon, I'm going to end, as we're coming close to the end, I'm going to end with really going back to this concept of the importance of language, and, you know, how we term things, and what language we use in everyday life, both to convey meaning and not. But going back to what you had argued in your book, you know, the way man or humans deviated from, let's say, non-human, and I'm making loads of language faux pas here by my ignorance, but you would argue that systemizing was more important than language development, that Chomsky or others would have argued, you know, was quite important. Can you tease out?
No, please finish.
Yeah, can you tease that out a little bit more for me?
Sure.
As to maybe the relevance of both, or why systemizing you felt might have led more to inventions than the development of communication or language.
Yeah. So, I mean, there's no doubt that one big difference between modern humans, Homo sapiens, and other animals is language. And we don't want to kind of minimize the importance of language. But in my book, I guess I want to slightly shift the focus to a different psychological process, this ability to see patterns, particularly causal patterns, and that it might be, to some extent, independent of language. So, for example, you know, somebody may have minimal language, but nevertheless be very gifted in music, and be able to invent in music. And music, of course, is a system. They may have very minimal language, but be able to understand mathematics. And again, that's another system. It's a numerical system. So language, of course, shouldn't be kind of minimized in terms of what it's enabled humans to do, that we can share information, for example. But the capacity for invention, I don't think, can simply be reduced to language.
Right. I guess what you didn't get, and I don't know, it was very helpful in that systemizing the if and then concept. And I'm aware that I haven't really given you the opportunity to kind of share that. I feel I can't leave. I thought it might have come out. Do you want to just say within systemizing, you know, that, because I guess I agreed with you in terms of you could really see how that does lead to invention.
Yeah. So when I've talked about, you know, human beings, modern humans, from about 70,000 years ago, being able to invent because they see special patterns in the world. It's not just any pattern. It's these very specific patterns that you just called if and then. You know, if I take the number 3 and I cube it, then I get 27. It's a kind of, that's an example of a little mathematical system. And then you can play with the if, you can change the input, you can play with the and. So instead of cubing it, you might square it, and you would get a different result. That's just a little example of how we might understand a system and then come up with new systems by playing with the patterns. And we do the same thing when we make things, when we engineer things. We do the same in music. You know, one of my favorite examples looking at the archaeology was the earliest musical instrument that's been found, which was from about 40,000 years ago, which was a flute made from a hollow bone from a bird. And the person who must have picked up this hollow bone and invented it as a flute, as an instrument, may have been thinking, if I blow down the hollow bone and I cover a hole, then it makes a particular note, if and then. But if I blow down the hole and uncover the hole, it makes a different note. So you have, you know, somebody experimenting with patterns. And you see humans doing this all the time. You know, we experiment in order to invent vaccines, or we experiment in order to, put a spaceship on Mars. We're playing with patterns to come up with new ways of doing things, but it seems to use this logic, this if and then logic, and it's a form of thinking that seems to be particularly well suited to the autistic mind.
Yes. Well, Simon, thank you so much for going through the whole concept of systemizing and pattern seeking. And I guess, what really is important is, the focus on that not only contributing to inventions, but being such a skill or such a positive aspect of individuals who, as you say, autistic individuals, where there might be a preference in many of them for that systemizing way. And I guess it's to be able to untap that and support it so that it actually does lead to, fulfillment, development, progress.
Absolutely. I mean, if I could just finish with a reminder to, the audience today, but, more broadly, that the majority of autistic adults are unemployed. And yet we're talking about how many of them may have strengths that could be a benefit in the workplace. So we really do need to identify what are the barriers to getting autistic people into work, because we know unemployment is bad for our mental health, whoever we are.
And I guess our involvement in UCD with our neurodiversity kind of project really came from Stanford, and I didn't give sufficient credit to Untapped Holdings in Australia. We're supporting them in that, and it very much starts at that level, which is about, trying to optimize occupational opportunities. And I guess we would hope we would start working backwards towards starting at the university and the employer level, but then being able to influence, primary and secondary education.
Absolutely.
And at the same time being mindful of that broad, the power of knowledge sharing with the Joe Soaps, in whatever way that everybody is aware of it. Well, I want to thank all the attendees. I do apologize for not looking at the chat. I'm I didn't want to divert my limited attention to dealing with the chat. So I apologize to a few people who've asked questions. But Simon, really, thank you so much for taking your time to present to us today and for kickstarting the International Neurodiversity Society's masterclasses. And if I could draw your attention to the next masterclass next month, which is on the 25th of March by Ronan McGovern. And there's a list there of all others that are scheduled over the year. So Simon, thank you very much, and stay safe during this difficult time. Must be the first time we haven't mentioned COVID for a while, but it's been a pleasure.
Thank you very much. You too.